Welcome to Carolina. The purpose of this video is to share a bit about our rotational experiences and just give you a sense of our educational programming. So give us a good look. We're really looking forward to meeting you.
Welcome to Chapel Hill, UNC ObGyn. I'm so happy to actually welcome you to our wonderful department where we have 10 incredible divisions. They're well balanced with outstanding leaders both in clinical education as well as research spheres.
On the benign gynecology rotation, our chief, second year, and intern resident teams spend a lot of time in the OR performing a wide variety of major and minor procedures with the advantage of working with both the specialist and minimally invasive divisions. During the second year, there's scheduled and supervised time for FLS and robotic simulation training, as well as experience in dedicated pelvic pain clinic with our pelvic pain specialists.
For me, I was really lucky enough to have exposure to urogynecology as my first rotation in second year. I do think it is something that I'm going to end up pursuing as a fellowship option down the line, and I don't think that I would have been able to feel comfortable in that decision had I not had the opportunity to work with those faculty, those patients very early on.
Clinic experience at UNC is one of the first times in your residency that you will really feel like a doctor.
So that's when clinic was when I first started to feel like I was really coming into my own as a doctor.
There's nothing more satisfying than the gradual independence that you gain under the supervision of expert faculty and the increasing expertise that you will get with minor procedures.
So our family planning rotation is a great opportunity to have a lot of one-on-one time with both the family planning faculty and the fellows. It is a rotation where you will get to take care of families with complicated pregnancies, early pregnancy loss, unplanned pregnancies, maternal complications, fetal complications. Really, our goal is for you to get a really patient-centered approach to taking care of families going through these complications. When you finish up this rotation, you will have excellent procedural skills and will be really comfortable counseling even medically complex patients about their contraceptive options.
So our family planning experience is incredible. We get to incorporate it into all 4 years of residency and get everything from dealing with really complex contraception for people with really complicated comorbidities to doing tons of procedures at Planned Parenthood, if that's something that you want to do, where you really get the opportunity to take care of these patients in some really challenging moments of their life.
Our attendings are really great about giving us autonomy and making sure that we are very comfortable with the procedures that we perform, as well as with counseling. We get to spend time at our hospitals at UNC in Hillsborough, but also at Planned Parenthood here in Chapel Hill. And you leave the rotation feeling extremely comfortable to perform procedures and do all of the necessary things.
At UNC, we do our REI rotation during our first year and our fourth year of our medical training.
So our reproductive endocrinology rotation is awesome for a lot of reasons. Number one, we get a ton of hands-on experience with doing early transvaginal ultrasounds, which I think is really unique and really prepares us for our time as second years and third years when we're interpreting and reading ultrasounds for our emergency department consults. Another special thing is that we get to work really closely one-on-one with our attendings. They spend a lot of time sitting down and really going through the feedback loops and the systems that really help us understand the day-to-day treatment and evaluation that we do in benign GYN in clinic all the time. And then lastly, it really gets us comfortable treating and evaluating the basics of infertility in our own clinic patients.
So the Urogynecology and Reconstructive Pelvic Surgery rotation is a terrific experience for our second year and our fourth year residents. They get full exposure to all depth and breadth of female pelvic floor disorders, both in the outpatient setting and in the OR setting, as well as procedural settings. We have a lot of experience with reconstructive pelvic surgery, both vaginal and minimally invasive, be this laparoscopic or robotic. The opportunity to get exposure early in the second year and then again to revisit exposure to pelvic floor disorders, I think really stands us out amongst our peers with that balanced exposure in the curriculum for the residents.
I'll do Urogyn because I did not expect to love that rotation as much as I did. And it was my early in my second year that I got to do that rotation. And it felt at first a little bit intimidating because, I knew I would be the only resident there with the Urogyn fellows and the Urogyn attendings operating all day for most days of the week. And those nerves were quickly eased by, again, these incredibly kind and brilliant surgeons that served as my teachers for that 8 weeks.
We rotate at 2 different sites. We rotate at UNC and we rotate at one of the community hospitals, Wake Med. And it's great because there's completely different patient populations at each hospital. Wake Med is very high volume. You learn a lot of normal labor, more low-risk patients. And at UNC, we manage very high-risk patients with a lot of comorbidities, and we really learn how to handle like the maternal fetal medicine patients and patients with, on various medications, chronic diseases, and you really learn how to manage laboring patients during your first year.
OB at UNC is awesome. As an intern on my second day, I was able to get in the OR and do a C-section. We're delivering babies all the time. It's so great working with our attendings and the awesome nursing staff. You get really great support from your chief residents and your upper level residents who are just always there to help you out.
Obstetrics at University of North Carolina is a unique experience. It offers a wide variety of complex patients and a high volume as well. It's also a really special place because your upper levels, when you're an intern, are always trying to get you involved in C-sections and get you to the OR. It's also a special place because you get to take care of patients from a wide range of background and a very diverse patient cohort.
You're managing labor. At Wake Med, you learn how to do kind of the normal labor, which is really good to dip your toes into the water, but then you see the more high risk scenarios at UNC, and you have some of most world-renowned MFM doctors there helping you, and the fellows are great and teaching all along the way, and it's a really great experience.
Gynecologic oncology, if you ask me, it's basically the best specialty that there is. There's nothing else that anyone else would want in life but to be a GYN oncologist. It basically amounts to everything that it is to be a physician, and you get to really see that in the GYN oncologists here at UNC. Not only do they do complex surgeries, bowel anastomoses, pelvic exenerations, but they're also handling complex chemo, and you get that benefit as a resident to experience all those things, whether you're in an exent with Dr. Soper, Dr. Clark-Pearson, or whether you're managing someone who's on chemo on the inpatient side, as well as all their medical comorbidities.
So I'm currently on the GYN oncology service, and it was a rotation that I was nervous about going into it because it's really complex patients, complex social situations, complex diseases. And I've really enjoyed it so far. I think that I've learned a lot medically about how to care for really sick patients, but also just the environment that you're in. You're surrounded by world-renowned leaders in the field, which is something that's really special. And then the team that you're with.
I came to Carolina because of the prison, which always sounds like sort of a funny answer. But UNC has been providing care to the women who are incarcerated in our state prison system for decades. And I came here because that was a population that I cared about tremendously and wanted to be a part of it.
We were voted the best place to have a baby in Raleigh by the local newspaper and recently listed as one of the nation's best maternity care hospitals in Newsweek. We do over 3,000 deliveries a year with a 20% C-section rate. We do over 300 hysterectomies and over 1,500 GYN surgical procedures per year. ObGyn residents rotate at Wake Med twice each during their first, second, and third years. Altogether, residents spend almost a year total at Wake Med.
Wake Med is a wonderful opportunity for the residents to practice many different aspects of ObGyn. You also have a great gynecology experience and are working with attendings who are experts in obstetrics and gynecology and are very strong in both of those fields. And the amount that you learn from your attendings alone and the relationships you get to build with them at Wake Med is probably one of my most favorite things about being at Wake Med as a UNC resident.
One of the biggest reasons that I chose to stay at UNC for residency was the opportunities for global health research. Since I've been here, I have been able to work with many of the faculty within our global health division and have actually been able to get a significant amount of funding for my research activities. I think that we are very uniquely set to get great training in research, one, because of the faculty that we have here, but also because of the structure of our research mentorship.
Regardless of your ultimate career path, whether it be academic, private practice, or fellowship, you will benefit by having a strong foundation in general OBGYN, and we hope to have a part in that.